So hello, everyone. I'll be starting us off today. If you have any problems hearing any of us, please let us know and we will adjust that. But we're very excited to share our final defense presentation for our capstone project titled Pre-exposure Prophylaxis Access Navigator, creating an application cheat sheet for the Trillium drug program. It's a bit of a mouthful. So this is the general structure of our presentation here. We'll talk about the process of discovering this project, our methods, trials, findings, the implications of our work, and the key lessons from our capstone journey. So to start us off, pre-exposure prophylaxis, or PrEP, is an HIV preventative drug for those who do not live with the virus. When taken properly, it can reduce the risk for infection to almost 0%. However, in recent years, Ontario's HIV rates have risen, and the uptake of PrEP is lower than what experts have projected. In May of 2024, our team took note of this trend and chose to dig deeper into why these trends might be the case. To do this, we followed the Toronto Translational Framework, or the TTF. The framework is divided into two parts, the understand phase shown on the left and act on the right. So for our initial investigation, we focused on the understand phase, and this is about defining the problem through direct engagement with the problem space. In our investigation, we decided to take a multi-pronged approach where we engaged community members, read existing literature, and looked into media sources. This strategy helped us triangulate knowledge from different information sources and identify undercutting themes. We opted to have informal discussions with community members as we had direct access to these networks, and we found the method to be more flexible than typical methods such as surveys. Initially, we had gone into this space expecting individuals to comment on the lack of access to PrEP specialists. However, these preconceptions were quickly challenged. We engaged two LGBTQ plus individuals in the 2024 Pride Toronto Festival, and we also took time to speak with workers in the HIV prevention field. Among these groups, we noticed some recurring themes. Some individuals were hesitant to begin PrEP use, citing both financial and health concerns. Those who noted economic reasons mentioned that they have difficulties fitting the high costs of PrEP in their budget. When probed about existing funding supports, many were unaware of any assistance programs. Similarly, those working at HIV prevention organizations often pointed to two key barriers against PrEP use. First, many are unaware of the different coverage programs available. Additionally, those who try to access these programs face informational and administrative barriers, which can be significant deterrents, especially among individuals who are already busy with other aspects of their lives. These sentiments were echoed in the existing literature, where concerns with PrEP cost and lack of user-friendly support were often mentioned. And finally, we encountered a CBC article that called for more accessible coverage systems and reduced medication costs. This article, along with the community members we had spoken with, frequently mentioned the Trillium drug program, which helped us to narrow down our focus.
So what we found is that the TDP is a provincial assistance program that can help cover the monthly cost of PrEP, which is approximately $250. However, prospective applicants face difficulties in completing the application. In the literature, this experience is described as an administrative burden. The learning costs of understanding the TDP, such as its language, requirements, and deadlines, are high, which deters them from gaining financial coverage. Ultimately, this drives down use of the medication among those in need. As such, the current state is that prospective applicants face substantial learning costs when navigating the TDP, impeding their ability to secure funding independently. Through the development of a support tool, we'd like to promote the desired state, where applicants are able to independently secure TDP funding for PrEP. So this brings us to our exploratory question, which is, what features are needed in a digital support tool to reduce administrative barriers and improve successful completion of the TDP application among Ontario residents aged 24 to 64 seeking PrEP coverage? To create our support tool, we chose to complete a two-phase remote user-based evaluation study guided by usability testing principles. In the setup, we invited individuals from our target population to independently complete a series of tasks using our tool. So first, we had 10 participants complete the TDP application without any sort of external support, and we noted areas of difficulties as well as their feedback. Using these insights, we developed a navigator tool. We then tested the tool in batches of 5 participants, where we retrieved their feedback and subsequently used their insights to further improve the tool. We repeated this cycle 3 times before we reached our final prototype. We chose to conduct usability trials rather than co-creation sessions or focus groups because trials allowed us to directly observe how users engage with the tool in a simulated setting. This approach provided insights into actual user behavior and challenges rather than, say, relying on their perceptions or assumptions about what they might need. And we thought this would offer a more objective assessment of the tool's usefulness. So for recruitment, we followed a community-based recruitment strategy where we partnered with 3 HIV prevention organizations who disseminated our recruitment materials. We recruited Ontario citizens aged 24 to 64 years old who were interested in accessing PrEP through the TDP. This approach helped us to engage individuals with lived experience or interest in PrEP access, ensuring our sample was relevant and grounded in the real-world context the tool aims to support. Across all trials, we recruited about 25 participants. Our sample was racially diverse, with Middle Eastern, Latino, South Asian, white, and mixed individuals making the largest shares of our group. And notably, we did not recruit any Indigenous folk in our study, which is a critical gap in our current work. Now, most participants were cisgender men and transgender women. All participants identified as LGBTQ+, with half declaring themselves as queer identifying. Many of our participants held a high school diploma and earned below $50,000 per year, and majority of our participants kind of skewed younger. And this was particularly interesting to us as current literature indicates that young Canadians aged 20 to 30 are experiencing the highest rates of new HIV infections in the country. Now, for the trials, each participant completed a solo Zoom session, and they were given a simulated scenario and instructed to complete the TDP. Participants followed a read aloud protocol where essentially they were verbalizing their thoughts out loud to us. We observed their screen as they attempted each task, and the team took note of, say, the time taken for each application step, the number of errors that were made, as well as the nature of those errors. At the end of the session, we had participants rate both the TDP and Navigator tool, and they also gave feedback on their experience by responding to a series of open-ended questions. Now, 2 individuals on the research team joined the trials. One was designated the interviewer, who was responsible for facilitating the session, asking reflection questions to participants, and ensuring trial steps were completed properly. Interviewers followed a pre-created interviewer guidance document to ensure standardization. The other person was a note taker who completed a note taker sheet to record various quantitative metrics. So this is like time taken to complete each step and the number of errors made by a participant. Both members also had access to a standardized errors protocol that outlined the types of errors that might be made, and a clear procedure on how to respond to these errors were established to help promote standardization. They also had access to an answer key on hand to keep track of participants' progress and any potential errors that might be made.
So in each trial, we recorded various outcome measures. The note taker timed how long each step took and recorded both the number and the types of errors that were made by the participant during their application. We paid special attention to errors that could lead to delay, rejection, or reduction in TDP funding, which we labeled as critical errors. This included inaccurate claims, incorrect household information, and incorrect income information. We also had each participant verbally rate the TDP application and the Navigator tool on a validated 5-point Likert scale assessment, and that allowed us to gauge the usability of the systems and measure user experiences. Users' subjective scoring was used to support our qualitative analysis of the participants' feedback. After we completed the application scenario with a participant, they were asked a series of open-ended reflection questions to elicit some more specific feedback. Trial transcripts, including both the talk aloud and the short interview sections, were qualitatively coded using emergent coding methodology in vivo by 2 members of our research team. Coding trends, thematic analysis, and the interviewer's initial insights all informed the iterations of our support tool. During our baseline testing, where users completed the application without any outside of support, we observed that each participant made at least 1 critical error. 70% of these errors were made up of 4 mistakes. First, not uploading prescription receipts. Second, not inputting incorrect household information. Third, inputting incorrect legal information. And fourth, inputting incorrect income information. As you can see on the right, users often complained about the clarity of the TDP application's language and requirements. So our qualitative analysis of this testing resulted in themes related to difficulty understanding language and instructions, challenges with locating and navigating TDP resources, and feelings of uncertainty and confusion while completing the application. These critical errors and the participants' feedback about their experiences completing the TDP application on its own helped inform the first iteration of our tool. This alpha version assessed users' eligibility for the TDP and then offered some step-by-step application support. It also guided users to other forms that they might need to complete after submitting their application. So, as you can see here, we structured the first version of our tool to mirror the TDP application with a linear flow. In our alpha tool trials, we observed a general decrease in the amount of errors made by the applicants. However, most participants did note that the tool's step-by-step workflow could be a little tedious or inconvenient. For example, participants who didn't have insurance didn't need help from the tool on the insurance page and would stay on the TDP application page without clicking through the tool as they progressed. So when these participants hit another obstacle, they'd have to click through the tool until they reached the point they wanted help with, and that could be irritating and frustrating. Again, this feedback was reflected in our qualitative results. We used these results to inform the next iteration of our tool, the beta version, where we introduced a dashboard structure. With this new setup, the applicants were able to navigate between specific sections as needed instead of clicking through on a linear flow. The beta version of our tool also reduced application errors, and participants found that the visual organization of the dashboard design was intuitive and convenient. However, we did need to address some issues we found in the legal and household information sections. We noted that participants still found the application's language confusing and had some difficulty determining the most appropriate selection for their specific scenario. This could result in participants making some assumptions that could lead to incorrect application selections and therefore a critical error. In response, our team integrated quick assessments into the tool, and this allowed users to identify the most appropriate selections on the application form. We're happy to share that participants using this third tool iteration did not make any significant errors in their application and expressed satisfaction with the tool overall. Now, while our series of trials showed that using an application support significantly reduced critical errors of all types and improved the likelihood of successful application to the TDP, our thematic analysis found that not only did applying with the tool improve metric outcomes, it also had a meaningful impact on our participants' experiences. So participants discussed how successfully applying to the TDP the first time was really important to them and placed significant financial stakes on rejected or delayed applications. They discussed feelings of anxiety and confusion while they were navigating the TDP application and provided feedback that stressed how inaccessible the dense language could be. Many participants discussed how using the tool, on the other hand, made them feel more confident and capable in their ability to apply successfully because the tool provided answers and clarification when they had questions and broke up information into clear and easy to understand sections.
Now, this iteration is our current prototype, which you are more than welcome to interact with using the QR code on the slide. As you can see, we've kept the dashboard feature. Where we've laid out the process in chronological order. We also have a balance of quite a short questionnaires for various aspects of the application and brief informational paragraphs. To summarize, our tool caused a meaningful reduction of critical errors made on the application and received generally positive responses from users. In real-life setting, this application can be used to reduce the demand for application support on HIV workers, allowing them to dedicate more time to other HIV prevention initiatives. Additionally, folks from communities who cannot physically reach support workers or those who do not feel comfortable receiving help in person can especially benefit from this virtual tool. However, there are limitations. We led our trials using standardized scenarios. This approach does not align with reality where users are going to be using their own information while navigating the tool. The scenarios also introduced a wide volume of information that felt overwhelming for some participants, which could have made our trials even more difficult than it would have been in real life. Additionally, the scenarios did not address fringe cases, raising questions about how well our tool is equipped to address special circumstances. Participants also sometimes noted feeling pressured while being observed by the research team. Others actually found our presence reassuring, so it is really unclear how the absence of the team would alter interaction with our tool. There also needs to be more additional research into different communities and their specific access needs. This includes those who face language barriers and stigma around PrEP use that may be caused by their cultural backgrounds. These findings can be used to improve the tool and add more supportive features. Our knowledge dissemination strategy spans across individual level, academic communities, and hopefully systems. Following the advice of our PAC, we share the application resources with study participants. We will also soon share the Navigator tool with them. Our team also has attended various conferences. Previously, Zoe gave a poster presentation at the ACTS conference in Washington, D.C. Shayan also gave an oral presentation at the LMP Research Conference in Toronto. And last week, Shayan represented our team at the European Health Design Conference in London, UK. We hope to publish our work in a scholarly journal and advocate for more accessible coverage applications. We have identified Digital Government, which is an interdisciplinary gold open access journal that focuses on potential and impact of technology on innovations and transformation of public institutions and governance. We will also look to engage the Ontario HIV Treatment Network, who we've learned that is well connected with the various HIV prevention organizations within the province. Now, moving forward, we hope to integrate our tool into the AIDS Committee of Toronto's HIV support site so it can be used in real-life setting. We would integrate a quality improvement survey where users can give their opinions of the tool and ways that we can improve it. In terms of research, we need to conduct more group-specific work. We may also look at partnering with other HIV prevention organizations who may also find our tool helpful. Many of these organizations, such as Black Cap and ASAP, are geared towards supporting specific cultural and racial populations, which could help elicit more community-specific insights. Hopefully, with continued improvement of our tool, we can work to have its interface formally integrated into the official TDP site. Now, as we close our implementation phase, 3 core lessons have emerged from our experience. These insights will help us refine the tool further and guide similar projects in the future. First, we quickly learned that members in our team communicate ideas in very different ways. This would lead to miscommunication during group meetings, miscoordination in tasks, and ultimately some friction between members. To address this challenge, we first reaffirmed our shared goal to succeed as a team. We then discussed past instances of miscommunication and identified the root causes. In our reflection, we realized that we did not establish shared terminology of various project components. Additionally, in group discussions, we would jump between different topics without explicitly voicing the shift in our focus, leading to some confusion. We practiced checking in and clarifying with other group members to help counteract these difficulties. We also faced difficulties during participant recruitment. We received emails from many individuals interested in participating in our work, but we had trouble tracking each individual's progress throughout the recruitment process. Additionally, we did not have an internal system to keep track of who on the team was speaking to each participant. This lack of coordination raised the risk of team making unprofessional mistakes and complicating the recruitment process. Recognizing this gap in our internal structure, we established clear expectations and roles within our group, as well as a standardized tracking document to ensure that everyone in the group was on the same page throughout this process. And finally, our team also faced some difficulties in navigating feedback. We're incredibly lucky that our mentors are so passionate and invested in our project. They have brought great insight and have elevated our work a lot. However, at times we received valid feedback that felt out of scope of our project. Because these suggestions highlighted limitation in our work, we felt pressure to fully implement the changes. But on the other hand, we knew that these changes would alter the direction and also focus of our work. As a team, we had to learn to navigate this tension and identify what feedback we should implement and to what extent. In developing this skill, we learned to act as leaders in our work and discern when implementing changes felt right to us and our broader goal. Additionally, for recommendations that we did not implement, we made sure to highlight those as gaps in our work and explicitly voice them as future areas of work. Now, with the completion of our project milestone, our team looks back with pride as we see all that we have accomplished. We are truly grateful for the support of our PAC members, supervisors, and community members throughout this entire process. We look forward to hearing your questions and comments. This concludes our final defense presentation.